Mr. Blunt.
Thank you, Mr. Chairman. It's Blunt Amendment number 1. It's the one that deals with pharmacists. And I'm going to read the amendment because it's so quick. It just says, nothing under this subtitle shall prevent a pharmacist from collecting and sharing information with patients in order to reduce medication errors and improve patient safety. Mr. Chairman, new rules in this bill concerning electronic health records may actually discourage implementation of new technologies. The bill says without prior written consent, healthcare providers, including pharmacists, may not be able to use electronic healthcare medical records to engage in, quote, healthcare operations, end quote. This could include such activities as just simply recommending a generic drug as an alternative. Under the bill, only people who give prior consent would have access to this kind of information from a pharmacist. The public health care function that pharmacists provide to patients is critical and shouldn't be hindered. The amendment does not alter the privacy and consent provisions. It will allow pharmacists to continue to collect and share information with all patients in order to make sure they have the most accurate and up-to-date information about treatment. And again, this is very straightforward, and it just simply says that nothing shall prohibit a pharmacist from collecting and sharing information with patients in order to reduce medication errors and improve public safety, Mr. Chairman.
Gentleman, yield back the balance of his time.
I will. No, Mr.
I just briefly want to say I support the amendment.
Gentleman's time has been yielded back. The chair would recognize Mr. Pallone in opposition to the amendment.
Well, Mr. Chairman, basically what the underlying bill does is prohibit a provider from getting direct or indirect payment in exchange for using protected health information. The bill, as it stands, doesn't preclude, the pharmacist from making these communications. A pharmacist can send a refill reminder to any and all their patients without an authorization if they believe it's best for their treatment. But they can't be paid by a third party that does not necessarily have the patient's best interests at heart. And providers can request patient authorization to use their information for marketing efforts if they want to. So I think that the bottom line is we're just trying to prevent somebody from being paid by a third party when it's not in the patient's best interest. And I think that's a proper balance here to allow these communications when it's in the best interest of the patient for treatment, but not when the pharmacists or others are going to use it as a marketing tool and they're going to get paid to provide that information. So I would urge opposition to the amendment for those reasons.
Gentlemen, yield to me.
Yeah, I yield to the chairman.
Yield to Ms. Eshu.
Oh, yield to Ms. Eshu.
Thank you. I just wanted to ask Mr. Pallone, you know how much we agree with each other so much of the time and whatever. Your explanation of this, I don't think, squares away with what's in the language. I mean,
go ahead. Ask me
how
what
do the pharmacists, how do you leapfrog from, they're collecting and sharing information with patients to reduce medication errors and improve safety for them? How does that leapfrog into the advertising that you're talking about?
Well,
how does it morph into that?
Gentlemen, yield to me. I don't think it. I think that if the pharmacist wants to have communications with the client or patient, there's no problem with that. What the problem is if a drug company goes to the pharmacist and said, "Give me the prescription drug refill reminders that you're sending to your patients who are taking a particular drug, so that we can then send advertisements to them to take a different drug." Right. And so it's a third party that intervenes. If your pharmacist has information about the drugs you're taking, that shouldn't be given to anybody else. And so this doesn't interfere with, as I understand, the pharmacist-patient relationship. It precludes a third party from getting involved.
But it doesn't say that, though.
In the amendment itself?
It doesn't. I mean, it's the way I'm reading it. There's barely 4 lines here. Nothing under this subtitle shall prevent a pharmacist, doesn't say the drug companies or anybody, shall prevent a pharmacist from collecting and sharing information with patients in order to reduce medication errors and improve patient safety.
Well, you're talking,
Am I reading the same
Mr.
thing?
Malone?
if I could
It
reclaim-
replaces, it's instead of the provisions that prohibit the practices that we're talking about. So it doesn't say that, but it's in lieu of that.
Mr. Chairman, could we have one additional minute on each side on this?
Without objection.
I thank the chairman.
Blunt.
Nothing in that language allows pharmacists to share with outside parties. It just allows them to share with patients. I mean, it's very straightforward. If Mr. Plone is correct, and the bill prohibits pharmacists from entering into some sort of paid relationship or relationship where they make money, that's fine. All this amendment says is that this doesn't prohibit pharmacists from communicating information with patients. It doesn't address communicating information with drug companies. Maybe they are prohibited from some sort of third-party pay, but this, unless the patient was third-party paying them, this shouldn't prohibit that, and I'd yield to Chairman. I'd yield to Chairman Barton.
Mr. Chairman.
Along with Mr. Markey, I'm one of the strongest patient advocate privacy rights in this Congress. I support this amendment. This does not deal with marketing to outside. It says sharing information with the patient. That is a good thing, not a bad thing. We should support this.
Mr. Pallone has 1 minute.
Well, my concern, if this language in the amendment is added, is that it could be interpreted to say that you can share this information even if you are getting paid, and you don't need the authorization from the patient. In other words, it would directly repeal and say, okay, if the third party now decides that they want to share this information and pay me, I can do it without the prior authorization of the patient. And I don't really understand what you'd be getting at unless that was the purpose of this amendment. That seems to be the purpose of it.
Gentleman still has.
My concern, Mr. Chairman, if you will, is that this directly undermines and would say that the pharmacist could now get paid and, share this information without the prior authorization of the patient, and it therefore would directly repeal what we have in the underlying bill. That's how I would read this amendment.
Mr. Pallone, if you
Well, let me. It seems like some confusion, and maybe we're arguing about something legitimate, maybe we're not. Would you just pull it back, and we'll come back to it
Yes.
by unanimous consent,
Yes.
even if we've gone to another title?
Yes.
Okay. Without objection, the amendment is withdrawn without prejudice.